Jambo Espresso Talk Today community. Akwaba to the Espresso Talk Today show. Welcome to Espresso Talk Today. I'm Amma Robin. You can just call me Amma. I'm the host of this great and groundbreaking Black empowerment podcast show. If you're just joining us today, then I wish you an especially happy and hearty Akwaba, or welcome to the show, and to the Espresso Talk Today community. We are a Black empowerment community of amiable intellectuals, and we welcome everyone. We discuss everything, from the happy and uplifting to the uncommon and the uncomfortable. Nothing is off the table here. Today's show is about a topic that many people find difficult. And many people avoid it, they avoid talking about it, they avoid thinking about it, and nobody wants to experience it. Yet, we all will experience it at some point in our life. This topic is grief, loss. Today, we will talk specifically about Black grief, and this is a uniquely Black experience. What is it? Is it a thing? We're going to explain what it is later, but I can say absolutely yes, it is a thing. I know that some people will say that grief is something that we'll all experience at some point in our lives, everyone. So grief is not a Black thing or a white thing. It's just a thing, a colorblind thing. I believe, though, that Black grief does exist, separate from the white Western experience of grief and loss that the great professor, Elisabeth Kubler-Ross, talked about. Now, no disrespect to her, not at all. She did great and groundbreaking work in grief, and I respect her work. But Black grief does not fit squarely into the Kubler-Ross matrix. The grief matrix. Let's see what you think after the discussion. Remember, here we don't tell people what to see. We point them in a certain direction, but you decide what you're going to see and what you're going to experience. Asante Sana to all for joining us today. And we are joined today by psychologist Mary Chappell. Let me tell you, take a brief moment to discuss and introduce Dr. Chappell. Mary Tatum Chappell is a Bethesda, Maryland-based psychologist who specializes in clinical psychology. Dr. Chappell is a mental health professional with highly specialized training in the diagnosis and psychological treatment of mental, behavioral, and emotional illnesses, including obsessive compulsive disorder, OCD. Her main focus, though, is on diagnosing and treating mental, emotional, and behavioral disorders. Some of the disorders that she can treat are learning disabilities, substance abuse, depression, anxiety, and eating disorders. She also knows an incredible amount about grief. Now, I separate it out because grief is not a behavioral disorder. It's not any kind of a mental disorder. It's an experience. And that's how Dr. Chappell is going to discuss it with us today. So a big Asante Sana to psychologist Dr. Mary Chappell for contributing her time and experience in discussing this topic. And it is a difficult topic. As you know, though, this is a Black empowerment podcast show. Black empowerment encompasses history, culture, community, political and economic power, spirituality, health, and lots more. Originating on the continent of Africa to where we are right now, Black empowerment is growing, evolving, expanding, and gaining more and more strength. Knowing that we are supported along this journey and that we're feeling empowered together. Let's get to it. I'll see you after our uncommon conversation. Hi, Mel.
Hi, Robin. How are you?
I'm great, thanks. And how are you today?
I am doing absolutely great.
I love that. And you can see that I am meeting with a dear friend, Dr. Mary Chappell, a psychologist. Dr. Chappell, Mary, this is Mel.
Hey,
Nice
good
to meet
morning, Mel. How are you doing?
you. Good morning. I'm doing very well, and I am so happy that you're here. How lucky can I be?
Well, thank you. Thank you for allowing me to be here.
Well, I'm also feeling like the lucky one too. And, but I said that Mary's a psychologist, but I have to say too that, we're not having a specific, counseling session right now, but we do have a topic that you want to discuss. And so I'm really glad that all three of us are here to discuss this and learn from and support each other too. Um, this is interesting because I often, before I do a recording, I talk to people about the topic that ETT will talk about. I may mention racism or, heart disease or misogyny, a lot of different topics, adultification, and people are really, really excited.
Mhm.
This time I mentioned grief, and
Mm.
there was a pause, and people would kind of back off. And it was something they seemed very uncomfortable with. So, so Dr. Chappelle, I want to ask you, what is it with this? And I mentioned a lot of other topics that are not easy topics like racism, but I've
Mhm.
mentioned grief. People back off. What do you think is going on with that?
The presence of grief for any and all of us is frightening. It's really frightening. And the fact that we are all subject to it, no one of us can avoid it totally. That causes us pause because we feel like we don't have control over what will happen if and when we slip into a grief state. So no one wants to wax infinitum on grief. No one wants to be there with that.
Wow, I mean, we talk about, death, you know, people, no one's really comfortable with that either, but people are willing to talk about it. But grief seems like it's something overwhelming, and everybody knows it's maybe unavoidable, but yeah, they really get uncomfortable with it. And I didn't know where to go with this. I thought, well, maybe this isn't the right topic, but I
Hmm.
have a feeling it's probably the exact right topic.
Absolutely, precisely because we grieve the loss of loved ones and family members, friends, but we also have ambiguous grief. We have non death grief. We grieve the loss of innocence. We grieve as even in the natural maturing process, as we grow older, we grieve the loss of change and functionality. We grieve the loss of the transformation. And grief is a poignant component of change processes. We grieve what we have to let go and say farewell to. And oftentimes, the grief is more about not redefining how we will proceed or what it means. Because grief could actually allow one to celebrate equally. But so many of us, traditionally and conventionally, we recognize it as a painful place. And so no one of us wants to discuss it deeply.
So, how would you define grief? I do have something you said. You said described it as a deep sorrow, but I have a
Mhm.
feeling it's more than that too. I mean, you gave a long explanation here, but deep sorrow, I think, is that at the heart of it, or is there something more?
And at the very core of grief is it's the depth, the greatest sorrow. There's nothing more voracious than the sorrow that one feels in grief state. And the other thing is that grief is not finite. It's not limited to this one time experience. Grief is like the tides. They go in and they come out. And so grief in the beginning will hit us like a huge storm at sea. And then briefly it might remit, but then something, an anniversary or a recall, will bring the tides back in. And so we're constantly working through it, and it's never over. It's never over. We redefine or refine what it might mean to us, but it's never over.
I read this book called "It's Okay to Not Be Okay," about grief, and she was saying in the beginning that after grief or in grief, you're never going to be the same person that you were before it. Do you agree with that?
I agree absolutely, wholeheartedly, with that, because based on the way we as human beings interact, we are evolving and we create who we are with every passing moment. And so when we lose a person or when we're losing something, that's loss. That's like cutting off an appendage, cutting off an arm, a leg, or something of that nature. And so, yes, I agree with her wholeheartedly. We lose so much in a grief state, and yes, it does alter and redefine who we are as we go forward.
You know, if it's it is. I agree. That's something that everybody's going to go through. Why is it that psychology, doesn't have a way to fix it? I mean, maybe it's not something that can be fixed, but yeah, why is it that it's so misunderstood in Western psychology?
In Western psychology, we're so accustomed to, first of all, we're an individualistic culture, right? And so we haven't captured the manner of interaction, recognizing what we mean to the whole, to the system. It's so individualistic. And so, in that, when we let go of the collective, we lose the opportunity to understand how we fit into that scheme. That's why in Western culture, grief is a no-no. It's a taboo discussion, actually. But in more indigenous cultures, you'll find that there are grief processes identifying how one fits into the community, how one's absence impacts the community in a more positive way, in a more wholesome way, in a fuller way. And so I think that is why here in Western cultures, we have such a difficult time processing it because we don't understand it as in the whole. We look at it as an individual experience.
And so, how is Black grief different? How do African Americans or Africans grieve differently? Because I am reading stuff too that there it is a cultural base, as you were saying. Indigenous people will have a different process. What about non-Western or Black or African people?
Mhm. Well, the greatest grief that I know, and clearly I'm an African American woman, but the greatest grief I know of and am aware of is that of Black grief. Black grief is complicated and incredibly complex and incredibly enduring, not because other cultures don't lose entities in their realm, but more so because of the very levels of grief. We have grief on top of grief on top of grief, and it's historical. We, from our very origins, we've been grieved. We've been grieving. When a Black child is born into this life, a Black child doesn't have the identity, can't feel confident about his or her identity just based on what societal dictates have done to that child. And the child isn't even aware. There's an innate sense of that loss that is then perpetuated throughout that child's lifetime. Equally, any one of us as adult women of color, we might feel that absence of identity. We might question who I am in the whole. Who am I? How does the whole value me? And that value piece dictates how we see ourselves. And so oftentimes we're even going through a life process of that grieving, the loss of self, the seeking of self, the understanding of who I am in this mix and this absence and this adjustment.
Wow. Wow, I see what you mean. Grief upon grief upon grief. Wow.
So
Um,
we're pretty much born, in a state as we grow up. The grief is already there. So historically and culturally, it's there. We've lost something that we're not even sure what it is. We're not even sure, how to feel about it or how to process it. And that's that loss is something that we all live with as African Americans. I mean, how can you live with that? What can you do to live with that?
mm,
And in some ways, it sounds like that might be a rhetorical question, but I'm sure that it's far beyond that. Living with that, I know for me, and in psychology, it's shown that if we can find purpose, if we can find meaning, if we can find value, that will help us proceed and progress. And sometimes, in for lack of a better time or a better concept, overcome. So finding value, meaning, and purpose. And value, meaning, and purpose can come from giving back to your community, giving back to your family, giving back to those who may not um, have what they need. And your being that provider can give greater meaning, greater value, and can help us move beyond the depths of the grief process into the brighter spaces of progression.
Oh, that's amazing. I really uh, impressed by how you put that together. You mentioned loss, and is some of our loss anticipatory? I mean, we will wonder, where we are, where we're going, how we will be seen or reacted to, and that type of thing. Would that be a part of a grieving process or not?
Absolutely. The anticipatory grief is a profound grief in that we when we're going into a new setting, we know that we are women of color. As we go into that new setting, we don't know what we might expect. We were born Black. We know that we're Black. I know that in my community, I'm accepted. But if I'm going into a new setting where I don't know what to expect, I can have a premonition, if you will, a pre-grief, an anticipatory grief, where I'm anticipating the loss and I start to feel the burden, the sadness, the sorrow over what if I get here and they don't accept me? What if I get here and they don't embrace me? What does that mean to me? What if I'm devalued? What if I'm dismissed? And so we can, yes, begin grieving equal. And that's kind of conceptual grief, anticipatory grief. But we can also have anticipatory grief in the process, if we're in the process of watching a loved one as they deteriorate. Oftentimes, some of the chronic illnesses that in our culture we face, um, cancer, diabetes, things like that, where you're progressively deteriorating, degenerating. There's an anticipatory grief that can accompany that process because we're watching and waiting as someone may be losing themselves. And as they are losing themselves, we too are equally losing, feeling that loss. Grandmama used to know me. She would smile when I come in. Now she seems confused. That you begin to grieve that. I want grandma to know who I am. Or, my husband has endured these kinds of things. And on the one hand, I want him to feel the relief from the pain.
Mm.
But equally, I may have a need to hold on to him. And so there's this battle in the anticipatory grief process that can cause us to feel a whole mix of confusing emotions. So sometimes we think of grief as simple sorrow, sadness, but sometimes it's anger, sometimes it's rage. Every now and again it comes around and it's actually lofty laughter, right? I'm gonna miss you when you're gone, but I love these times together. So it's very complex and it impacts us in many different ways.
Mhm.
Hmm.
What does the systemic or structural racism have anything to do with this anticipatory grief?
Absolutely. As people of color, system I'm sorry, structural racism or systemic racism does impact how we extend ourselves, how we are together in things, and how we are the barriers that we face as we're going through these grief processes. And so sometimes we negate our grief because we are oftentimes proud people, even if we haven't learned that. Our younger generations may not acknowledge the pride, the power that they have within themselves. And the system has muted that within them. And so that the systemic grief or the structural grief strategies causes difficulty, greater difficulty than our counterparts in navigating how I'll get beyond this, what I will do next with this. Because our grief, we can often use it to catapult us into better times, but oftentimes we are left stewing in the sorrow because no one has introduced us to how we overcome and become beyond this grief structure.
Wow.
I heard a term. Actually, it was in your notes, and I thought it was really interesting, called suffocated grief. And I wonder if, let's see, you describe it as, when grief is not just unacknowledged, it's also punished. And to me,
Yeah.
that also seems to go back into slavery too. I don't know if you want to go in that direction, but yeah, can you elaborate on this?
So again, as we were discussing grief and its complexities and presentation, um, oftentimes in our younger generations, there's not a know-how with regard to how I should grieve. And so it comes out um, as means of acting out, right? Anger, rage, this child is a disturbance. And so if the child is punitively penalized for that when the child has had a profound loss, some of our children are going through so much. They've lost not only family members, but friends. To be 14 years old and not be able to walk the street with your friend, or to have lost a friend to violence or something else. There can be what appears to be anger or rage that sets in. And from the observer or the onlooker's perspective, this is just bad behavior. And this bad behavior needs to be corrected, redirected. And so that's what suffocated grief looks like. It looks like the loss of acknowledgement that I'm going through so much. But then that's exacerbated by me being penalized, punitively penalized for my expression of grief in this way. So rather than sitting with me and coming to understand and being compassionate and helping me manage and navigate, you tell me, go sit in the corner or go do more homework or I'm going to lock you up because you did this.
Mhm.
And that's where suffocated grief situations come into play.
Now, does that come from parents or a system that just don't understand what a child is going through when they're grieving, um, or i- or is that an example of children being adultified? Kind of particularly Black children, children of color, being treated as beyond their years. Um, yeah, what is that? Is it bad parenting or not? I don't want to call it bad parenting. I don't want to judge the parents. But yeah, is it parenting that just doesn't understand, or is it a system that is really being punitive?
You know what? I don't think you can separate the two. I think systemically we've learned to operate this way. And so, yes, a parent may misunderstanding how to function within this, handle things in a parentified or adultified way with their child and say, you get over it, get up, you need to get on with your life or whatever. The thing is, in these systems, if we, as adults, if we're not taking the time to understand, if the community isn't rallying around our greater depth of understanding, our betterment in processing, then we're going to continually kind of perpetuate that situation, suffocated grief and or adultification or parentification, which is where we force a child outside of their developmental structure into functioning in a more advanced developmental stage, right? Our expectation is that because the little girl looks grown, she must perform as someone older than her years. And so therefore she will be penalized if she doesn't. So we rob people of their innocence. You ask, is it, you know, parents not understanding, or is it the system? It's and all. It's everything.
Okay. And then what happens to a child from that? I mean, if they're not getting the understanding or the support or the structure that they need, I mean, does the anger continue? Does the acting out? Does the isolation? What where does the child go from there?
So, as you mentioned, yes, the anger can continue. The acting out can be a manifestation of that anger continuing. There can be, you know, here in the States, we have correctional facilities that are loaded with youngsters of color, mainly male, but loaded with youngsters of color. And many of those youngsters of color aren't there necessarily because they would have made these poor choices in life. They just were misunderstood, and then that catapulted them into greater misunderstanding and behaviors that are less acceptable in our society.
Do you
That's
think,
really,
excuse
really
me one
interesting.
second, Mel, just one
Okay.
follow up on that. Do you think white children receive more understanding in their grieving than Black children do?
Well, I would say that as a society, yes, we probably lend a greater understanding or acknowledgement of maybe a child who is not of color. We understand or allow them a certain uh, latitude of behaviors, where a child of color, oftentimes the behaviors are misunderstood and misappropriated. So by that I mean, if a child of color has not been informed or allowed to grieve in a certain way, or held, if the space has not been held for his or her grieving, we all of us, even parents of color, communities of color, may perceive it as, again, bad behavior. And so, what that does when a child is punitively impacted based on their grief, it forces greater misunderstanding on their own behalf, misunderstanding of their own feelings, misunderstanding of how I address and acknowledge this. So, yes, it leads to more troubled outcomes overall for the child, but also for the community. Because if we're not holding our children in the way that they need to be held in order to effectively grow and effectively contribute to their life and our lives, we're countering what we would like to see occur. So I don't know if that answered your question.
It did. Thank you. Yeah. Wow. Wow.
Now, it's interesting that this is called grief. And uh, do we recognize some of these behaviors as coming from grief, or we haven't really defined it in that way?
Mm-hmm.
So should we be looking deeper when we see these behaviors in our children or friends or relatives or whatever? Should we be looking for that?
Absolutely. We should start by acknowledging and to sit with the child and help the child know that I am witnessing. Let's start with that. I'm witnessing. I'm not going to judge. I'm not going to define. I'm witnessing that seems things seem troubled. So we acknowledge it. Then ask. We ask, what is happening? What's happened in your life? What's happened in your world? How can I help you? We might accept that we don't really know. I'm not coming from your world. I want you to help me understand. And then we have to partner of sorts with that child. Make them understand this could be a safe place. This is how I can help you. Let's explore. And we also have to recognize that sometimes we're going to miss the nuances of what the child has said. Sometimes we're going to miss it. And when we recognize, whoa, I missed it, we circle back and we say, I'm so grateful that you were sharing this with me. And I know you said that lots of things are happening in your life. And I know you said that you miss your mom. Help me understand what made you say that,
Mhm.
so that this child can be empowered to speak to their grief. If we're just moving, and we think we know, but really we don't know, we need to pause and allow them to understand that we're willing to be there with them as they navigate this.
Hmm.
Oh, yeah. That's powerful. Yeah, and that takes real intentionality to really focus and try to understand what this child is going through, and not kind of define what their experience is, but to find out from them what, or to witness what their experience is,
Yeah.
and to take away a lot of ego too, to apologize, to align with them, and then to apologize, to circle back. That that's a big order for psychologists to do, any therapist to do.
Well, not only psychologists and or therapists, but all members of the community should be willing to allow some sort, not that we're putting on the hat of the professional, but recognizing that it's more about humankind. And so I just want to be a human being here for you, whether it's saying to the child or the parent or the family, these are the resources that I think could be helpful for you, so that they are in front of the professional. or if it's simply saying, I just want to be here and listen. I don't want to tell you, I don't want to guide nor direct. I just want to listen. Because sometimes we just have to purge all that has been stuffed in us. And so grief can be stuffed in you, especially when it's perpetual grief. For those of us who are of color, melanated skin, we see grief far more frequently. We see vicarious grief processes in that we have to take it in on the news and we're hearing about it from friends and family and we're losing our own loved ones. It's just, there's so many layers. So, yeah, it's not just for the professional, it's for the community to hold space for how we purge and decompress from all of these grief factors.
Wow, yes. Mm. Um, then I saw that there's a difference. You brought up about stuff we see on the news, and now I'm thinking about collective loss. And um, I know that a lot of people bring up Emmett Till, and as though we are all grieving him. And I have a feeling that I've been grieving him my whole life. It seems that his name, his story has always been there. And yeah, when the movie Till just came out, I was afraid to watch it. And some others independent films have come out about it too. I was afraid to watch those. And I realized I think I've been grieving Emmett Till and Martin Luther King and Malcolm X and
Mhm.
Chadwick Boseman. You know, and when I
Mhm.
saw the Wakanda Forever, it seemed to me that the honor that they showed him in that film means that they needed to acknowledge that there is there are people grieving him. I mean, his family, of course, his friend, of course, but people way beyond that. We were all grieving Chadwick Boseman. I mean, is this something that I'm just making up, or is there really this collective loss and correct collective grief that we're experiencing?
You know, nothing made up, Robin. You are precisely on point. We are, as a whole, as a people, we are grieving. And yes, when iconic figures fall, like Chadwick Boseman, Martin Luther King, Twitch, the individuals who we've found in the forefront of our meaning and our value base and who we are, when we lose those people, when they are fallen heroes and or not, um, we do have what is known as collective grief. And sometimes in the collective grief, the process, on the one hand, seems to keep going because we are seeing it on the news or we are talking about it in the barber shop. So it keeps going on and on and on, and we can't walk away. One of the beautiful things about not walking away is the opportunity to process and redefine what that loss means to us, to find spaces of honor and privilege with regard to having had access to that entity in our life, um, awareness of how they have impacted us. You know, if we were to reflect on the collective grief that all of us feel, or many of us, I will say, many of us feel, based on Martin Luther King's loss. You know, if we were to reflect on the collective grief, I'm certain that many, if not most of us, could find some joy in some of the quotations that we take from him, some of the words that he has spoken, some of the efforts that he has made. And when we look at how those efforts have impacted our todays, that's part of the honor process that comes out of grief.
Mhm.
Yes, I'm sorrowful that I've lost this man, and I'm elated that I had the opportunities to have him be a forerunner so that I have these options, or so that I could learn and know. Or, if it's someone that we've laughed with, or those kinds of things. These are the moments that we need to move away from the sorrow of grief and look at the success of the celebrated life.
Hmm.
Mm-hmm.
Yeah, that's amazing. Is there a medical component to grief? A person is grieving, and because of that, their medical issues develop. Has that ever been a situation?
It's a situation yesterday, today, and tomorrow. In that grief can the sheer volume of grief, first of all, for a community can bring one down. It can elevate our blood pressure. It can throw our sugars out of whack in diabetes. It can, the stress that the system is put under can lead to cancers and other chronic conditions. And so, definitely, the grief factor can take the body through so much torment if it's not addressed appropriately. So yes, physiologically, chemically, our systems can change just based on the grief factors.
Wow, wow, that's amazing. So, how do you know when you should consult somebody that the grief is beyond, say, the your ability to manage it with friends and family?
When we look at how, if the grief is hindering our function, for example, if I'm day one, grief is exhausting, any emotion is exhausting, but day one, if I'm sad that I've lost this significant other, and so I may be tearful on day one. But if by day 10, it's difficult for me to get out of the bed, it's difficult for me to eat, it's difficult for me to perform my daily functions, then it's e- evident. If we have gotten beyond a week or two and our life kind of processes have been impacted, can't get up and go to work, I can't feed my kids, I have difficulty showering, we need to look further, deeper into this. We need to see if some psychological intervention or medical intervention. Some of us go to clergy. We need to be certain, however, that wherever we're taking those grief factors is a safe place,
Hmm.
and that the source that we're looking to for guidance, that they are willing to sit down with us in an open way, with an open mind, and hear what our true feelings are. Because oftentimes we come with a surface presentation, but we have greater feelings. We might be angry that the individual has passed on and left us behind here to deal with all of this stuff. Or so the sorrow may present as sadness because it's more acceptable for some, but men, it's not acceptable for them to feel sad. So they then may present it as anger. So
Hmm.
the individual who's helping us needs to be available and open-minded in order to hear whatever we're bringing to the table. So if you have a loved one and they've stopped doing what they need to do to live their life, yes, it might be indicated that, let me see how we can get you someone to talk to about all of
Hmm.
Mm-hmm. But if men often may show anger,
it. Hmm.
what about for women? When people who identify as women, is this more crying, or is what is it? How does it present more?
For some of us who identify as you mentioned female, For some of us, it might be tearful. Some of us, it may be numbing, right? I just can't talk. I don't want to engage. I'm disengaging with everything because I've lost this part of self
Mhm.
or this significant other. So more often than not, it might present in sorry in an adjustment, but and even if with someone who identifies as female, there may be that grand presentation of anger, of confusion, of frustration. So,
Mm.
Okay. Wow. And I saw, let's see, that you mentioned, which to me looked like warning signs,
mm-hmm,
um, loneliness, for the perception of being a burden, and the
mm-hmm.
acclamation to death. I'm not sure. I don't understand what that one is. Could you explain those three, please? Yeah.
Certainly. So, there have been some research studies done uh, with regard to our attempts on our own lives and completion of those attempts. So, in other words, suicide. So, the primary factor in someone's attempt on their life would be loneliness. And loneliness certainly accompanies grief oftentimes because we lose part of self and sometimes our entire community. The second one is the perception of being a burden. And so
Mm.
if we functioned with a partner, sometimes when that partner is no longer with us, we can we can perceive ourselves as becoming a burden on our children, becoming a burden on the community. Oh, now my neighbor has to come and bring me food or take me to the grocery store or to my appointments. And so the perception, not the reality of being a burden, but the perception of one being a burden can be the second factor that can contribute to an attempt on one's life. And the final one is the acclamation to death. An acclamation to death, if someone is in a family where we've had many losses, or if we live in a community where there's a lot of violent activity, or if we work in a profession, I'm a law enforcement officer, or I'm a medical doctor, I'm a surgeon. And so you have acquired and adapted a way of living with loss so that you can keep moving. That's an acclamation to death. And so
Mm.
if you have those three factors, they often can lead you closer to considerations on your own life.
Mm. Mm. Wow.
Mel?
Yeah, I was really interested in, I mean, how as Black people, as African Americans,
Mhm.
even though we might have a loss due to death, we always have a feeling that that person is there, that that person is guiding us or protecting us or giving us messages or still loving us. Have you found that to be the case?
Absolutely. And that is, in my opinion, the most beautiful part of Black grief.
Mhm.
The fact that we are intentional in our continued connection, intentional in our continued reverence, and looking back and acknowledging. I don't want to impose anything on anyone, but from my perspective, I firmly believe that the energy that I feel from, those that I have lost, I recognize that it truly, in my opinion,
Mhm.
is their continued communication, guidance, their being with me in the spirit of witness to help me navigate this thing that we call life. And so in African American and or Black cultures, we are sometimes misunderstood by other cultures in that continued connection, in that continuity and consistency of belief, of faith that I know that my significant other and or others are guiding me. We even look toward ancestors that we've not been familiar with, but those same ancestors offer us the energy in order to get through. In many other cultures, there are not those same practices and or beliefs, but specifically in the beautiful Black culture, that frequently is a way of our connecting and allowing ourselves to be able to be strengthened to go forward.
Well, Mel, remember when we were in Ghana that we saw a funeral procession,
We
and
did.
everyone was wearing white, and it was such a beautiful thing to see. I mean, people I wouldn't say were joyful and all of that, but there was a just such a dignity and an honoring and a beauty to the procession, and in that they were wearing white, which our guide told us that that was someone who an older person who had passed, and that they had completed their cycle, and I just yeah, it just brought tears to my eyes to see that and to know that this is how they're honoring, and I think those rituals are so important, and understanding what they mean, and when I mean, I know the Espresso Talk today audience knows that I'm a big believer in therapy. And I know when I had someone close to me pass away, and I saw two different therapists trying to decide who I liked but more. And when I mentioned that I've experienced, this person coming back in their energy, the therapist who was not a person of color, I could see she tolerated it because she thought, well, this brings her comfort. That's okay. But the therapist who was a person of color, completely jumped on it and understood and helped me to take it forward and to embrace that. So it was yeah, just a very different experience. But I mean, I think those rituals are important and understanding them are too. So
I think that's
Absolutely.
true. Yeah, I think that's true. Remembering back uh, in time that a lot of times the parents, you say if you lose a mother or a father or whatever, the other parent would say your mother would not want you to do this, or your father is very proud of you for having, but that person is no longer there. Have you had any experience with those kinds of situations?
When you say, have I had experience? Absolutely, I have.
Mhm.
And I I definitely am a proponent for honoring the presence of your mother and your father and whomever is no longer there,
Mhm.
because the energy was there and we need to embrace it. And so yes, to help a child navigate, what would mommy say about you doing this?
Mhm.
How is it? How, when you made that shot, what do you think was happening in your father's heart? Those kinds of things when they're at the basketball game and honoring the presence, that spiritual connection can truly fortify. And it not only fortifies the living, it also fortifies those who we have lost.
yeah.
That spiritual connection is actually a necessity. And Robin, as you had spoken to your working with the therapist, you mentioned that you had therapy from individuals from different ethnic persuasions. And the therapist of color was more willing to acknowledge your understanding of spirituality, and the therapist who was not of the same ethnic persuasion tolerated. I wanted to applaud you for pausing and vetting your therapy resources. Absolutely should be done, not only in grief work, but across the board. When we're working with someone, we need to see them maybe once, maybe twice, maybe 4 times before making a definitive decision, but also recognize that we don't have to defer to that one person's way of being in the world, way of engaging, their understanding. Seek where you would feel safe. Allow yourself to know that it's important that you feel safe and you trust the resource. That's the only way we can get the help we need. So,
Yeah, thank you.
mhm.
Yeah, I realize that, yeah, people are different. A doctor isn't a doctor isn't a doctor. Everybody, approaches things differently. So yeah, thank you for acknowledging that. And
Yeah.
but I am not going to grab a second espresso. So that means I think we're going to have to wrap it up, because then I never stop 2 espressos. So, well, I want to thank my sisters, and thank you, Dr. Chappell, so much for being here today. And I mean, this is, as I said, not an easy subject, and but I felt you were a safe person to have this discussion with. So thank you very much.
Thank you. Thank you for allowing me to have the discussion with the two of you. It's safe, sacred stuff, and I was honored to be able to do it with you all.
Thank you. I have a better understanding of grief and its wide arms now than I had before. So thank you.
Yes, and thank you for letting us know too when it's important to seek help and warning signs, because when you're deep in it, or when someone is deep in it, we've got to try to help ourselves and try to help others too. So thank you very much for that. Okay. So asante sana, ladies, and I will see you soon. Okay, bye for now.
Bye.
This concludes today's discussion about Black grief. Jumbo community, it's Alma again. Wow, this was an interesting discussion with Dr. Chappell, wasn't it? And it wasn't always an easy one. We felt, though, at Espresso Talk today that it was so important for Dr. Chappell to join us for this discussion about Black grief. She discussed the different types of grief. Had you ever heard of collective grief or suffocated grief? And it was very interesting to hear how children are affected differently by grief and loss, and how they express their feelings of grief and loss differently than adults. Unfortunately, many adults don't understand or recognize these signs, so children and adolescents are punished simply for expressing their grief and loss feelings. We need to take time to understand them, and as Dr. Chappell said, to listen to them, to listen to them. Children and adolescents also experience grief from experiencing adultification. Parents, schools, law enforcement, the media, all cause adultification in Black boys and girls. Dr. Chappell explained that adultification is when we treat children like adults and we demand the same expectations from them. Then we're disappointed or sometimes angry when these children don't meet our adult expectations. This deprives children of their childhood. And with this loss of their childhood through adultification, many children experience feelings of grief and loss. And these feelings are never addressed or supported. By the way, adultification is also a uniquely Black experience. Society doesn't have the same expectations of white children, and they don't put the same demands on them. But Black children are burdened with this, and it usually has terrible consequences. Collective grief was very interesting to me. I can see how Black communities experience this regularly through the loss of Black leaders, through witnessing police violence, through the untimely loss of young Black men and women, through the incarceration of Black men and Black women, or the removal of Black mothers and fathers from the home. The murder of George Floyd caused fear and anxiety among Black people, but it also caused a collective grief in witnessing his murder for nearly 9 long minutes while he was calling for his mother. The murder of Breonna Taylor, Trayvon Martin, Tyree Nichols, and so many others have also caused collective grief. Even going back into history, as I mentioned, about Emmett Till, that was in 1954 or 1955. Dr. Martin Luther King, Brother Malcolm X, Chadwick Boseman, and others stirs up collective grief. And this is felt in Black communities. Dr. Chappell validated all these feelings. Collective grief is real. The feelings are real, and they are felt deeply and experienced deeply. Vicarious grief is also real, even though you might not have known the deceased person personally. You know their name, and that is enough. You might even know their story, but we can experience grief through another person. And these feelings are all Black grief. Dr. Chappell, towards the end, also mentioned the warning signs that grief could be causing deeper problems. This can lead to death by suicide. If you feel that your grief is overwhelming after a few days, or that you can't get out of bed or otherwise function in some capacity, then you need to seek help. And please don't feel ashamed or reluctant to admit that you need help to deal with the grief feelings. Please try to seek out a therapist who understands you individually and culturally. I'm going to list several places where you can find a good culturally competent therapist in the show notes, which you'll find at the Espresso Talk Today website. Black people do experience grief on a regular basis, and the grief starts at a young age, younger than in white societies. Non-death grief is also felt very acutely and very regularly in Black communities through the loss of a job, the loss of a relationship, the loss of childhood, the loss of future goals. However, our culture and community can help and support Black people during their grief journey, our grief journey. We often turn to church, our family, and our ancestors. We turn to spirituality, and this is often misunderstood and discouraged or even pathologized in white Western society. Black grief is real. Our cultural and ancestral rituals are helpful and real. And let's acknowledge and honor our feelings of grief or loss, because one day we're all going to feel it. And if we acknowledge our rituals that are helpful, that'll get us along the way. Asante Sana, a big Asante Sana to Dr. Mary Chappell for generously contributing her time, energy, and expertise for us, and to you. Asante Sana actually to you for showing up and staying with us. We appreciate you and your presence and your continued support. You really are the reason that we do what we do every single day. And you can join us every day to discuss these issues on Instagram at Ama Robin L, formerly Espresso Talk Today. Check out my profile. Leave your questions, comments, reflections, or just anything you want to say. I want to hear from you, and I'm here for you. If you think that other people would be interested in this Black Empowerment Podcast show, then please send it on to them by all means. We got to start talking about these issues, and we got to keep talking about them. If you or someone you love is experiencing deep grief, please don't go it alone. You can contact the Association of Black Psychologists, or you can contact BetterHelp. to get in touch with a grief therapist or psychologist. Don't be shy. Make the call or contact them by email. It could save your life or the life of someone else. The information is on the website, on the show notes. You can go directly there. And if you want to keep discussing or just reading about these issues, then I would definitely want you to subscribe to my weekly newsletter, The Normal Beat. We discuss lots of different issues there. You can get your dose of Black empowerment every single week. It's never a dull moment, but there are lots of growth moments. You can subscribe at the Espresso Talk Today website, espressotalktoday.com, or on Instagram on my profile page at Ama Robin L. That's the letter L. I'm Ama Robin for Espresso Talk Today. And remember, now more than ever, strength, soul, and reparations. Ashe, community.